What can be done for major medical services? Again, this solution has been operating successfully for over 30 years, but most consumers didn't need it because they had insurance that was affordable and took care and met their basic needs, but affordable financial protection against unexpected cost of medical services has gone up dramatically as insurance companies eventually focused on profit taking. They passed that expense along to their corporate clients primarily, and those corporate clients passed portion of that on to their employees. So over the decades, since the 1990s, more and more of this financial responsibility has been pushed right down to the consumer. When problems grew to crisis proportion, the government stepped in with the Affordable Care Act, and that was obviously highly controversial. It was what I consider a Band-Aid to provide more affordable health care that was paid for by the consumers. As the government always does, they obtain all their money from consumers through taxes. So all they do is reallocate wealth. It was during this period of the Affordable Care Act that medical cost-sharing communities began to attract more followers. There was a problem. Medical cost-sharing communities only existed in the faith-based communities. That's where it originated 30 years ago, and that's where it remained for so long. But as the cost of health insurance escalated, our free market system went into action, and companies began emerging that brought health share out of the Christian community and into the open market and made it available to everyone. So earlier in this episode, I said health insurance companies inflate the cost of medical services by 80 to 100%. So if by bypassing the insurance industry and obtain services at half the cost, then join a sharing community that can reimburse members for medical expenses, we have become smart consumers of medical services, and we're in control of our own health care. If Americans were able to observe the evolution of health care over the past several decades, it would be easy to see how health insurance industry has taken control of health care away from the individual and now regulates access to medical services. So how do we become smart healthcare consumers? This damaged healthcare system is not going to fix itself. Change will happen when everyone begins to see healthcare as a consumer product and starts treating it as such. We're a nation of consumers. We shop for everything we have. All goods and services on the market are commodities. So we identify the goods and the services we need and acquire them at a fair market price. That's what we do. That's why we're shoppers. The healthcare industry is no different. We need to treat healthcare as a commodity, and it is a commodity. By becoming smarter shoppers and selecting the best services for the best price. As is the case with all consumer products, the industry has evolved to where it provides all the shopping tools necessary to support that transition, because the doctors and hospitals don't like dealing with health insurance companies either. We've all heard the stories about how health insurance companies dictate procedures to doctors that control the amount of time they spend with patients, to say nothing about what they will and won't pay for. Primary care service providers are reliant upon the insurance industry for their income, and big insurance has been squeezing the profit out of these medical services to the point doctors no longer go into business for themselves. As I said early in the podcast, this is one of the primary reasons for the shortage of primary care physicians in the market. Doctors aren't getting out of medical school and hanging out their own shingle. They are going to work for large medical organizations. Hospitals and major medical organizations are no different than the doctors. They do battle with insurance companies all the time. So making changes to accommodate cash pay patients is a welcome alternative for them. So don't be concerned that you'll have any pushback from these organizations when you ask for cash pay prices. Consumers should understand all the resources necessary to become a smart shopper